Hi, I'm Chaby Orfali, and welcome to the SBH Men's Health Roundtable discussion. We're here with 4 of our esteemed doctors from our community. I'd like them to introduce themselves, please.
Dr. Joseph Durzieh, GI, gastroenterology.
Dr. David Khaski, cardiology.
Dr. Ralph Madeb, urology.
Dr. Albert Ftiha, internal medicine.
Okay, so we'll just jump right into it. We have a bunch of questions tonight that everybody, always discusses and sometimes doesn't discuss. And we're going to have a roundtable discussion and hear from all of our doctors. First question is, do you believe that men ignore their health? For example, we're all busy, we're all at work, we're coming, we're going, making excuses not to go to the doctor. I'd like to hear from Dr. Ftiha first, please.
Yes. Men's most of the time ignoring their health for 2 main reasons. The one main reason, they're afraid to hear bad news. They try not to get diagnosed or get knowing about their health. The second reason also, most men, they think themselves are a superhero. They are strong. They're not going to get weak. They don't want to go to the doctor to find out they have a disease or something going on. So they try to ignore it. They make excuses by getting busy or they have work to do, and they try to get away from physical or any checkup.
Dr. Khaski?
Yeah, I mean, that definitely is very common and prevalent in the general population, but also in our community. So I think, the main thing is nobody wants to hear bad news. But I think, maybe the past couple of years, there's definitely more of a trend of people becoming a little bit more interested in their health. So I think as physicians, I think it's important for us to try to accommodate patients, especially men. And I think a great modality that we have now is telehealth. So patients are able to communicate with the doctor via video chat, and we're able to do it at off hours. So we can accommodate more difficult work schedules and stuff like that. But it's definitely a challenge, and hopefully by talking about it, we'll make it more accessible to the men in our community.
It's not only our community, it's all over, It's well known, they did study actually between men and women, which one neglect more. They found that the men, they don't like to go for a well checkup. They don't like to do any screening. They don't like to go for, even if they have symptoms, they like to ignore it. They think maybe it's nothing, maybe it will disappear. And if you Google, because most of our information, we get it from social media, usually they tell you, maybe it's nothing, maybe God forbid it's bad. Women, they choose the worst scenario. Men, they say, oh, it's nothing, most likely it's nothing. They're scared, they don't want to know that, as you say, that they don't want to feel that they're weak or they have some big problem.
I agree. I mean, I think that if you look at all the Fortune 500 companies, they actually created, it's not just in our community, I mean to say, that if you look at the Fortune 500 companies, they've created in their own departments, in their own systems, doctors that come there because they know that it's neglected. And you know all of the C-suite, the CEO levels, they have these concierge physicals and things of that nature because they know that they're going to find excuses not to do it. But I think that the trend is what you're saying. People are getting a little bit more scared. I think COVID really pushed people over the edge to understand that we're frail. Everybody's going to die. Our bodies are going to change in midlife and then midlife. And I think that as you see, the bigger companies are trying to bring the doctors to them to accommodate for them. So I agree with you. I don't think it's just in our community. Men overall try to downplay their symptoms.
I also believe that a lot of it falls on the doctor, and I think the doctors of today are a lot more convincing or telling their patients that they need to go check something out. When my doctor tells me, oh, I would like for you to check this thing out because there's something there that I'm not sure, I don't see, right away in my mind I'm like, okay, he's my doctor, I have to listen to him, and I go. And I think today the doctors are a lot more aware of men not willing to go to make excuses. Oh, I have to go to work. Oh, I'm away on business or whatever it may be. And they, like you said, they get accommodated So this way, they can't make these excuses anymore. So,
A lot of times we're also having pre-visit phone calls with the spouse, to bring up all issues that are there. So as a doctor, you're more prepared for the visit also.
But I think the most important thing these days, with the insurance age, what we call it, a lot of, just to touch on what the point of primary care or what the physical exam, what the annual exam mean for most men, they should expect in that physical exam. The concept of physical exam or having annual exam, not about just going to a doctor, get check up and go home and that's it. To create a relationship between you and the doctor for three major things, which is most people they ignore it most of the time. The main purpose of the checkup or having a primary care physician relationship, beside the health, beside also the mental health, and the third thing, the social aspect of the person. So since the insurance era, what we're living right now, a lot of people, they have hard time to keep their primary care physician or to trust somebody to go to. They keep changing from one to one, and they think it's this last year I have that doctor, next year I'm going to go to that doctor. So they lost the continuity of care. So the main point of having a checkup or going to a doctor to create a relationship, to have a baseline, what's your health is about, how to follow up every year about your health, and how to do the other screening.
I mean, we don't see this as much because, Chaby, you might not know this, but we're specialists.
by the way, I'm the only non-doctor up there, but
I just wanted to point that out. I just wanted to make sure
everybody knows.
Like, we're specialists, and he's a primary care doctor. So really, the burden falls on people like Dr. Ftiha. I think one problem in our community, but this is not just for men. I think it's everything. Is that America became fast money, fast food, fast. Everything has to be fast. They want to get a flu, and they want to be free. They want to be symptom-free in a day. It's not going to happen. It's not going to happen. And I think that, there's no fast medicine. And I think that the burden lies on people like Dr. Ftiha because you can't go to a doctor, and he's not there today. I'm going to go to another doctor. I'm going to get 3 injections. I need 3 injections, and then I'm free from all my worries. But it doesn't work
They
like that.
see 2 doctors on the same day.
Yeah.
They go from one to the other one till they get
Answer they want.
the answer.
So we'll jump to our next question. So, do you believe that there is a stigma within the community on certain preventative medical procedures, Dr. Madeb?
I think that I'm not sure there's a stigma onto the procedures. I think in women's health, for example, since they're hit puberty, they're told already they have to get a physical. They have to get mammograms. They have to get screening tests because it's part of their their maturity, their developmental maturity. Men don't have it. I'm not sure it's a stigma of doing the procedure or about a stigma of trying to have these done. So I mean.
Misinformation.
I think it's more of disinformation.
Misinformation. I believe they have more misinformation besides that embarrassing or they scare or fear from the procedure. Let's say look about colonoscopy. They get embarrassed, but they have some fear, but they have a lot of misinformation. I have a patient, like, he comes to pick up his wife after the procedure because she got sedation. And he was wondering, he said, why there's a lot of male patient around? He said, what do you mean? He said, I thought that it's only for female because her gynecologist recommended for her to do colonoscopy. She came for colonoscopy. He never in his mind.
You need to find out who his doctor
Right.
is, right? That he's not telling him to go to do colonoscopy.
Right.
But the idea is that in their mind, they believe that it's only for female and it's not from our
I
community.
mean, in my field, there's a lot of stigma, right? Because rectal examination is not
And
the
it don't give
easiest. It's the
sedation
easiest to
and-
go, That's my field, and so I know there's stigma in that field, but it's somebody else usually driving them into the office. So they feel a little uncomfortable. They feel it, but they're already there. That's why I mean that the burden lies on my good friend Dr. Ftiha, because and he's also primary. So you do primary too, so.
Yeah, no, definitely it's a difficult, I think the 2 main victims main targets that I have is urology and colonoscopy.
Yeah.
I spend most of my time, discussing that with patients and trying to push it and try to bring it up. But cardiac-wise, much easier. I feel like we have some screening tests, and basic history and physical really give you a lot of information. Get some lab work, check their cholesterol, check their sugar levels, their 3-month sugar levels. So I think that's easy. And then if patients have higher risk factors or family history, we do more testing to find out a little more details.
But it will help a lot. The moment that he educates the patient about colonoscopy or urology, when they come to us, they're already prepped. They accept the idea, they're familiar with it. It will make it easier for us because
Yeah,
they
and I
know
also
what-
think also, many middle age have older parents that already have cardiac problems. How many, just think about yourself, how many of your family members, right, have parents or grandparents on Crestor or Lipitor
Plavix,
or
or
Plavix or Lisinopril, right? So I think it just becomes natural for them. Where in our fields, Dr. Joe, it's a little bit more, they don't talk about it, parents don't talk about it. If you look at, in my African American population, they know very well, if there's a family history for prostate cancer, for example. So, obviously it's going to be genetic, it's going to be on a Y chromosome, it has to be because women don't have prostates. So, I think that the media, I talk about media, I think Schwarzkopf was up there and preaching to the army about black men having prostate cancer, dying from disease much earlier. It set off in the African American community sort of like this trend that they can't be embarrassed, they're going to die, the mortality rate is higher in prostate cancer.
they have-
But in our community,
we don't talk about it.
we don't talk about it. I never heard of my grandparents or my grandfather ever talk about anything private, anything below the belt, so to speak. They'll talk to you about their cardiac. I got 9 stents. This guy opened my chest, but they'll never talk
I
about.
think it's an old school
Yes,
mentality, and I think that the trend has definitely turned on that. There's no question. But it's a perfect segue to the next question. So, what are the most critical health screenings that a man should prioritize, and at what age?
So I think we'll touch on colonoscopies. Very important at 50. 50 used to be the old guidelines, but now 45. Unless you have a family history, then you would start probably 10 years before. Prostate screenings, if patients are symptomatic in their 40s, but definitely by 50s, should be seeing a urologist. Cardiac-wise, again, if you have high blood pressure, cholesterol, and diabetes, I call that the trifecta. So that should set an alarm off that you should be screened with certain tests. A simple EKG sometimes in the doctor's office, it doesn't give too much information, but doing more detailed testing.
Once a year or more than once a year?
No, it depends. If they have a normal test, usually the warranty period is like 5 years for like cardiovascular test. But if somebody is diabetic, maybe the warranty period is like 2 years.
Gotcha.
But stress test is important. I've been doing a lot more cardiac CTs.
I was going to ask about cardiac imaging. It's been many people asking me about
Yeah,
that.
it's exploding because, if I'm doing a stress test, I'm looking more for like obstructive disease. If somebody has a 70-80%, I really want to know if they have 20% because I can intervene at an earlier stage and make a difference later in
Well,
life.
you get to 20 before we get to 70.
Exactly. So if you're doing a cardiac CAT scan, sometimes with dye, sometimes without dye, that gives you very, very important information.
How sensitive.
Very sensitive. I would say if somebody has a normal cardiac CT, I think the negative predictive value is like 99%.
Yeah, it's a big thing now. I'm hearing a lot of people talking about it, and they have an algorithm, and they also have, I was because we got a new cardiac and community, and 64 slides the whole story, and they wanted a cardiac package because many patients, many cardiologists are. They have these crazy formulas that come in. They can predict the calcium. They can even tell you what's going to happen in 5 years. I think on that point, I'll mention urology in a minute, but on that point, I think that what's really helped, men in the entire country is that they became less invasive kind of things.
Right.
In my field, prostate MRI. I mean, anybody would come in with any family history or any PSA value, that's how I would rush them to biopsy. Biopsy is invasive, it hurts, there's a 4% risk of sepsis, but now with MRI, these 3 Teslas MRIs, they could see things you wouldn't see for 10 years. So there are negatives with that. You might be picking up things that never develop, but
Preclinical disease.
Preclinical disease, and this cardiac thing has really been set off a new wave. At least I can tell you from an administrative side, not because I'm not a cardiologist, but from an administrative side, they're pushing very hard to get these imaging modalities.
And also, I think from an insurance perspective, in the past it used to be very difficult to get approval. Now
I was going to ask that.
it's been much more.
Is it become? It's because it's becoming more of the norm.
Not
the
necessarily the norm,
I'm saying,
but
more frequent.
Yeah, definitely. I think the ease of the test, the predictive value, gives you a lot of information. But it's so I had like 3-4 patients just today that got cardiac.
I mean, from urology standpoint, it's like you said, it's 50 years old for screening,
Right.
but any family history goes to 40. Any family history. What is it in GI?
GI used to be all 50, unless family history you go 10 years, but we start to see they are doing good with colon cancer if you are over 50, but unfortunately we found a lot of young patients getting diagnosed with colon cancer. For that, in 2021 they changed it to 45 unless there's family history by age of 40. And they put a lot of rules now, like for example, like most of the cancer, we see it on the right colon, especially flat lesion. So when you do colonoscopy now, you have to see that how much it's like it take you to come out. It's called withdrawal time. You have to be minimum at 6 minutes. It's very important. Patients, they start to know this stuff. Even from our community, they come, they ask, how long it will take for the withdrawal? Are you doing second loop to go again back after you coming back to go again to check that area? We're using AI now. It came for the last.
I was going to ask that question.
You have to see how amazing it will help us, because even if you are perfect vision, sometimes you can miss. But now we have the machine. It will scan the colon. It will show us where is the polyp. We see the edge of it. It's amazing.
Wow.
You can see the polyp. You remove it. It will tell you if anything left, and you see green box around the polyp. So it's helping us a lot. It changed a lot.
Technology is it's good, it's good. But when it's bad, it's bad. So, and from the medical field, I hear it all the time. There's so many advances with AI specifically of what it's doing in the medical field and other areas that if we use it to our advantage, you can really
It will help a lot.
Yeah, absolutely.
Yeah, the other areas of screening that are important, I think, number one, AAA screening, like for abdominal aortic aneurysms. So if somebody smoked once in their life, or they smoked within the past 15 years, there's sonograms that they do to screen for abdominal aortic aneurysms, usually 65 to 75 years old. Also, if you want to talk
I don't
maybe
think
about...
anybody knows that, by the way.
Yeah.
I don't think anybody knows that. I never heard of this before. I
You
don't think
smoke
anybody
one
knows this.
cigarette, and you're 65 to 75, the insurance will pay for one-time
Wow.
screening.
Right, that's because I used to research for a very famous guy in Rochester. He actually detected that if you smoked at all, there's something called metalloproteinases that actually will keep the rigidity of the wall of the aorta. The aorta, just so you, I know we know, but you, Chaby, is the main trunk, that takes blood away from the heart to the whole body. The good blood, so oxygenated blood. So if you smoke, there's things that, so you want the aorta has to be flexible. So when you smoke, it deactivates some of the metalloproteinases, and then all of a sudden you get ballooning of the aorta.
Can I ask you a question? How does that differ with cigar, e-cigarette, vaping?
It's funny. It's funny. It's funny.
Because we know obviously how big of an issue that is.
Yeah, in our community.
Yeah.
So
I think all around.
I will tell you, just because you asked that, is that everybody believes, and they can attest, that smoking, forget what, smoking in general will cause lung cancer, right? But it's not just lung cancer. Actually, the second most common cancer in smokers is going to be bladder cancer. And it's because, just think about it, from the smoking, 50% goes out, the other 50% goes into your lungs, can do damage there, then it wants to go elsewhere. Now the kidneys have most of the cardiac output. So you're gonna get that, it's gonna go to the kidneys don't want it, ends it up in the bladder, and the problem is we don't piss every 10 minutes. We wait 4 or 5 hours, it sits in the
Go
bladder.
to the bathroom.
Yeah.
We're on camera, Ralph. I mean, I think we just want to be.
Yeah, it's still
But-
done.
No, I'm
It's
just
still
saying.
done.
I know, but still, you know what I'm saying.
So
That's
it sits in the bladder and causes bladder cancer. And just yesterday, I had a Jewish guy, very prominent, and not only that, he actually deals with medical referrals. And a young guy, tzaddik of a guy, really a great guy, great family, had bladder cancer. And listen, I have 1 cigar a day. It doesn't matter.
Mm.
So I believe that it's going to be related to any smoking.
Even secondhand smoking, even secondhand.
Yeah, even
smoking.
Yeah, yeah,
If you
yeah,
smoke
for sure.
The second two things I think is important while we're talking about smoking is screening CAT scans of the lung.
Yeah,
Very important.
that's the hottest thing.
Hottest thing if you've smoked in the past, you're 50 and older to get a screening CAT scan. And the last thing is, I don't know if you want to touch upon testicular cancer.
Yeah,
Screening.
so this is a big push. There was a great program by Hadassah, believe it or not, in non urban areas like New York City, that they actually went to public school systems and taught the same thing. Men, the boys had to do testicular exam because it was just, again, this is where women beat men in that they're told, since they're going to a GYN, and I think it's because they start to menstruate, they already learn their body, they understand this, they need to do breast examinations, they must do it, and testicular exam. And it's so important, you know why? Last week I had a brother of a Hatzalah guy. Can you imagine? Of a Hatzalah guy. He told me, everything's fine, everything's been fine. Comes to my office, rock hard testicle, and like 6 centimeters. This didn't happen overnight. And it was evident that it was cancer. And what happens? It was cancer, seminoma. But he did, says, no, I only noticed it 3 weeks ago. I'm telling you that the pathology in a young 25-year-old kid, this was going on for at least 12 weeks. 6 centimeters, the size of a lemon. So, if he would have done that as self-examination, which should start with puberty, just like a
How old was
female.
he?
He was 25 years old.
Yeah, the highest incidence is usually 20.
20 to 40.
Right.
So I think actually this is a good way to go to the next question. So,
But wait, just as a review, just so, because we want to review it, so that we were talking about colon cancer screening, prostate cancer screening, which is most common, right? There's cardiac screening, which would include, let's say, cholesterol screening, things of that nature. And then there's other ones,
Like they
Lung-
don't do bone density.
and,
like,
and aorta.
like for men, they're supposed to do also bone density the same as the females they do bone density.
Yes,
What percentage you think that from our community males they do bone density?
close to zero.
I mean, besides that, there's a lot of other issues which has not been discussed. All of this maybe you can hear in your offices. I have a lot of things we can get information from the patient. They never know about it. For example, which is things that has to do with health, with what we talk about screening. Patient who is overweight. The minute they come to my office, I start asking, do you snore? Yes, sometimes. Do you fall asleep during the day? Yes. Do you have some headache? Yeah. Sleep apnea, right there. They don't know what sleep apnea means. And they've been walking around with sleep apnea for a long time. Just by looking at the patient, by feeling that patient have risk factor for sleep apnea. And that can lead to a cardiac disease, as Dr. Khaski knows, will lead to obesity, one of the reasons for obesity. Other things, patient after age of 65, they come to you, I'm feeling always tired, I have no energy, testosterone level, and I've been underdiagnosed. Just very simple things, which is by talking to the patient, I feel tired, I have no interest, my muscles start to let me check your testosterone. They have testosterone deficiency. They don't know what testosterone, what the male hormone. They don't know about that. Third things, erectile dysfunction, embarrassing things to talk about. They come to you, they're embarrassed, they look down on the floor. I want to talk to you about something in the bedroom. They don't know how to say it. But they, after that, after a while, we have to talk to them, which is also our community very personal. I deal with, I have two offices. I have one office in our community, and I have office in Park Slope, which is completely different community, different group. They come to you open. They talk to you. When they come to the visit, they have a paper full of questions about
Google
the-
folder.
Google folder.
I see
and
pictures.
they come to me and they are free. They want to them.
I think it's a byproduct of the community and keeping everything closed and, you know, secretive and, you know, just not being so open with, you know, how many people want to tell someone else, oh, I have so-and-so. Like, it's not, and I think that that's the community itself. It's gotten better. I think people have gotten around that. Like, you know, back in the day, if God forbid somebody had cancer, you wouldn't know about
Right,
it.
right.
Now they have cancer, they're going and talking on Instagram and encouraging people to go get checked and do this. So it's a very different world right now. I think that just the community itself has to continue, you know, on that path. So the next question actually is for you. So how does our lifestyle impact men's health, and what key changes significantly improve overall well-being? So our lifestyle.
So our lifestyles, which is including Shabbat, and including holidays, including all these wedding, late wedding at night, and eating a heavy meal before you go to bed, and they come to you. I don't know why I'm gaining weight.
Yeah.
So,
By the way, I'm going to a wedding after this. I just want to let you know.
so it's a phenomenon in our community, because obviously we are different from other standard other communities. So Shabbat we come, only Shabbat, they overeat, they're not used to the type of food they're eating, they coming with the heartburn, and Dr. Durzieh got benefit from that all the time, and they also
Doctors have heartburn. I go to Durzieh.
also they don't have also time for exercise. We are so productive community, they are very hardworking, all of us, including doctors and people who are in business. They travel, they work hard, they ignore their health, which I was comparing between the two offices, between the community. You see difference between people, they put time for health, including giving some time for exercise, 15, 20 minutes or half an hour to go to the gym. They ignore that part. They also look for healthy food. They try to watch their weight, which has also been ignored in our community. They eat early, not like 10, 11 o'clock in the morning. So they do watch what they do to their body. And most of the diseases, actually, if all of you agree with me, what we eat, more than what we exercise. Crucial. So they think a lot of misunderstanding between exercise and eating. They think if I eat a lot, I can go for half an hour exercise and I'll burn it. It takes much longer time to burn what you eat in big meal. So it's either to eat less than exercise. I mean exercise is important, but also eat less would make it easier.
Moderation.
Right.
Yeah.
Right. Also on exercise, I think it's important that, you know, you have the person that goes and exercises an hour in the morning and then sits in the office all day long, and then you have the guy who doesn't exercise in the morning but is running around. So I think a median between the two is crucial. So you do some more intensive exercise for maybe a shorter period of time, and during the day you're more active and stuff. But I think most diseases have a large dietary component that is preventive.
Yes.
We're coming now to the summer. We have the maza party, the wine, all this.
Yeah.
It's like
It's all Ralph's fault, you're saying. Actually, you know, you brought up a point about the Hatzalah's brother or whatever it was that came to you. So this is actually a perfect question. So what are the most common symptoms men should not ignore that could indicate a serious health issue?
Look, in my field, it's multifaceted. So prostate cancer, which is very prevalent in men, there are no symptoms. If the symptoms are there, it's already very late. At least in my, and that's the point of screening. Dr.
the
Durzieh
same
has
as the
been
colon.
saying.
The same problem with the colon. Most of the time, polyp, zero symptoms. The moment there is symptoms, it's too late.
Right.
So you have to rush it.
So that's I mean, as a general rule, why we would screening. There are non-dangerous things. You know, we shouldn't paint a huge bleak picture. There are, you know, non-threatening, life-threatening diseases that do have symptoms. For example, which he so eloquently said, is that at 40, our hormone levels are going to change. Some at 30, some even at 20. And so with the decrease in testosterone, and this is specific for men's health, and this is what I see throughout the day. Again, it takes a great, primaries like the ones we have here to screen for that, and I see a lot of patients from them for that, is that when you have decreased muscle mass, no matter, even if they're working out every day, they'll tell you, I used to do 100 push-ups. Now, for me to get through the 100 push-ups, it's taking me longer, or I can't even get through to it. I'm talking about rigorous exercise. They start to realize that the muscle mass goes down, or thinning of their hair, or decreasing concentrating ability, difficulty sleeping, they feel cold, their sex drive, the libido is down, forget erection problems. There's just, all of that can be a signal of low testosterone. And I think that they're a little bit more, I think the media for the general population has already put that out. Low T, you got the gym guys who are like, and they're advocating for that. But I think that that's something that men should be aware of, that it's not their fault. Just like females have menopause, they stop menstruating, their bodies changes, but they're on top of it like this. Men, they wake up, what do you mean? I don't know what testosterone is. They know it in a general sense, but they don't realize that testosterone affects almost every part of their body. So I think in that aspect, you can pick up those symptoms. I guess maybe cardiac.
Yeah, so I think a lot of it is non-specific in men. Maybe like people might not come to me and say I'm having chest pain or shortness of breath. They might say, I used to be able to walk 10 blocks, now I'm walking 8 blocks, I'm just more tired. So like very subtle things. So that's a very, very important thing. So fatigue. The other ideas are, I'm very interested in symptoms, but I'm very interested in your family history. So if you had you had a first degree relative with a heart attack at 40s, I'm screening you at 30s. 10, 15 years before. Somebody has a little bit of plaque, it takes 10, 15, 20 years to develop. So I think that's important. The other things are, the classic, the chest pain, shortness of breath, the palpitations, I'm gaining weight, my legs are swollen, I'm lying down at night and I'm waking up short of breath. All these things can indicate cardiac, disease. So
I'll be interested also, because this I get is what about high blood pressure? Native high blood pressure
So
for men at 48 years old.
So what do we call it? A silent killer. So
Yep.
it's called a silent killer, which has no. That's the whole point of coming to have health checkup and have established a doctor you trust or you can go to, because a lot of things you cannot have. You have no symptoms. One of them high blood pressure, high cholesterol. You're not gonna have symptom high cholesterol. You're not gonna have high PSA with symptoms. You're gonna see it in the blood.
Diabetes.
So diabetes sometimes you also picked up by having a blood work. So to look at the health, we have to be very specific about men's age. We talk about age 18, what we see, until 65 and above. And men's health is not including about only what we spoke about medically. There's a lot of other social aspects. That's what family comes also important even the family, to notice how the man acting in the family. For example, if you notice weight changes, that's a big signal for us something going wrong. If patient losing weight without any reason, that's a signal for us we know there's something going on. If his mood changes, a lot of us in community are getting older, the average age, thank God, in our community getting higher. We see a lot of patients with Alzheimer, dementia. They don't know what this word means. They come with behavior changes, with
depression, anxiety is sky high.
A lot of also, the biggest thing is anxiety also, which is non-spoke about in our community.
I think that's one of the biggest ones,
Yeah,
if anything.
which is also affecting, not because the social pressure that we have beside our community, the standard level higher than other communities, also the social media, the speeds of life, which is going very fast, the expenses, it's create pressure on the man, which is running the show in the house, and he doesn't talk about it because he's a man, he's a superhero, he can handle everything. At the end of the day, it affects his health.
And by the way, I could tell you the opposite, where the man comes with a myriad of symptoms that you can't figure out. This hurts him, that hurts him. I have a kidney stone, and so he went to the doctor looks at him and there's no blood in the urine, there's, let's say, no infection, there's no nothing. Goes to another doctor, have belly pain, and he has nothing. He really does have nothing. What he has is exactly what he said, that sometimes the mental pressure that we have causes somatic symptoms. It causes real symptoms. He's not Majnun, he's not a crazy guy. It's just when you're that stressed, things can be taken out of
So
proportion.
I think you all read the next question before I even asked it, because you're already answering the next question. So they asked it, how can men effectively manage stress to prevent its negative impact on their health?
I'm the wrong guy for that.
So yeah, no, you're not even on the list there. Right? So
I think, I tend to rely on exercise a lot. I'm personally a cyclist. I love cycling, but I think exercise is one of the best stress relief. I think finding some time to yourself, so you're able to introspect. Yoga, meditation is always helpful. I mean, as a last resort, if some people have severe symptoms, they might need medications for that. But I think, trying, also to talking to somebody which is very, very
Taboo by us.
taboo. But I think
talking to somebody.
talking like a
like a
psychologist,
therapist.
a therapist, just, you have stressors.
Oh, there
and-
must be something wrong with you if you're talking to somebody. That's the way people think.
Right, exactly.
So,
No, but you have the stressors, and you might not be able to take those stressors away, but the way you handle the stresses, you cope with them. There's different coping mechanisms, so I think that's important.
But we have some positive also in our community, like we are well connected, like as a community. So you can share, you can talk to your friend, also it will help, when you're talking to your friend, socially you are connected, not only social media, but to real people, connected. And I believe if you start mentally like thinking positive, always like it's, even all this we're talking about it to improve quality of life, not to think about cancer or to worry about disease, but if you have it in your mind, always thinking positive and talking to people like close to you. If you have any symptoms, why not to discuss it with someone you trust, a doctor like you have connection to, it will help a lot.
And also, a lot of times you see cases of anxiety and depression, they try to treat themselves in the wrong way, which was what we also identify patient drug addiction, alcohol addiction, gambling, and they try to get away from anxiety by treating in their mind the natural way. If I'm anxious, I can maybe take a glass of alcohol and just to sleep it off, and also create a family situation in the family. It's not sometimes they come to us as a couple. They tell us he's always screaming, yelling in the house because that's why he expresses anxiety. He's always have sad face. So it's always when you have, as Dr. Durzieh said, you have somebody to trust as a family physician to talk about all this stuff, because all can affect your health in any way, in a conduct wise.
I think Bikur Cholim, honestly, did a major step in our community for making, the mental health awareness. I really believe that
Definitely.
it's much more accepted now than it was when I was a kid. And I believe that the only reason in our community is because of Bikur Cholim. That's one thing I give them a tremendous credit for. They've and I can't mention names, nor can I even think of the names I would mention, but it's just the brand of dealing with addiction, whether it's safe or Bikur Cholim, or dealing with the mental health. They've taken that taboo out of our parents' generation to our generation. And I think that's just a huge thing. And I think Bikur Cholim should take a role in health overall.
So I think, I don't have the statistic in front of me, but if I'm not mistaken, I think that when we look at how many hours, Bikur Cholim provided in mental health therapy, I think last year it was close to 20,000 hours, 19 to 20, yeah, something like astronomical that, that's the thing that a lot of people don't know, right? I mean, and when you think about it, that's a lot of hours. You start to divide the days and the hours and when you're up and all that. Even more maybe, I think could be 30,000. I mean, I'll get the statistics, but it's just, it shows you how more accepted it is now than it ever was in the past, and how it's no longer a taboo. Like, you're not crazy because you're going to speak to somebody.
And it's mean a lot of people need it,
Right.
unfortunately.
Right.
But,
But also one thing, but that also stems from they're going to the therapist because they're also speaking to somebody who realizes, for example, their social work, or they could be a case at Bikuchli, and then they're recommending them to go, and therefore, ultimately, what ends up happening is that kind of like the whole circle comes together, and then that therapist will refer them to a doctor who will, treat them to see, okay, what their issues are, and kind of like that's how you come full circle.
And it affects all aspects of health.
Yeah.
You know?
I agree. Just I want the question here. I mean, I'm going to go off topic for a second, but the question is, what role does diet play in preventing, managing chronic diseases? As men, I would say, not to use the stigma, but men are stubborn, right? Am I wrong to? I would say we're pretty stubborn. So when you now go tell a man that's been eating a certain way his whole life, and all of a sudden, how hard is it to get them to just follow?
It's,
The advice of a doctor of what they should be doing from a diet perspective and being healthy.
We recommend a lot to change diet, especially when they have heartburn and problem like with the stomach. I tell them most of the time, please bring your wife with you. Because if you give the message to the wife, she will follow on it. It will be much easier.
by the way, off topic, I think that's not only like, that should be like the gold standard of the night. I mean, the wife is critical in my field.
The question's coming
I
up.
will tell you 60 to 70% of testicular cancer is caught by the wife.
Whoa.
No, I'm telling you the truth. I'm
Okay.
telling you the truth.
I mean, moving on.
Yeah, so there's actually
It's true.
a
It's
great
a study. I didn't make it
I
up.
believe you. Can we move on?
There's actually a great book called Atomic Habits. I think I read it like 4 times. So it talks about doing small changes and getting used to small changes that make a larger impact. So I think especially with diet, red meat, big no-no. Colon cancer, cardiovascular disease. I mean, it's really red meat's minimizing it.
We're going into the summer.
It's
It's
hard.
barbecue
It's
season.
hard.
I know.
It's very hard.
Fried foods,
In our community, it's
more.
There's a price for our community's success. There's a price to it, and the price is that just take it. How many work here Friday in the summer?
I'm not a doctor, so I don't have to answer.
Part of the day.
Unfortunately, I'm a surgeon. I'm on call a lot, so sometimes I'll have to drive in. But all my friends now don't work on Friday, and now some of them are not working on Thursday. Now there's a price to that because you're going to want to indulge more. You're going to want to be
Hang out more.
and then like
Or the
like you said, you're going to have a
or the-
mazza. You're going to
all
start
this
drinking, and
is-
so it's going to cause a. But obesity is.
And you cannot not to go because of
I think the
Social pressure.
even if you're a doctor, you're gonna eat and drink.
The
It's,
best trick I have with the diet when it comes to diet, because I found it when you tell somebody to do something, the answer is no. And the best way is to do it the opposite way.
Mm.
You can have everything, but in moderation. And that's when they make them happy. Because impossible to tell, if I give you a diet now, I tell you, listen, this is your diet,
No, you can't.
breakfast, you're gonna follow it in a week or 2 weeks or 3 weeks, you're gonna drop it off. But the best way is to make somebody to follow the diet, to eat everything they want, but let them look at the food with numbers. That's why I tell them, just look at any kind of food you look at with numbers. How many calories is that gonna go to my stomach?
Mm-hmm.
I'm eating a piece of bread, that's 50 grams of carbohydrate, that's gonna give me 200 calories. So just add it, and at the end of the day, how much you put money in your bank account.
Just people need to be educated.
That's all.
I don't think they have enough education of what.
No, I think
good,
I think
what's
it's
not
also very hard. I mean, I don't think it's only. I think obesity is on the radar for a long time. I think it's extremely hard. I see my pain. Let me tell you how it affects my field, because you would think it doesn't affect urology. Fat in a man is estrogen. Fat, anyway. I'm not talking about how you look on the deal casino. If you have fat on your body, it's going to lower your muscle mass, and it's going to take your testosterone down. I'm just telling you from a very narrow angle, my field, not their field. Just doing that, you're going to have marital problems, you're going to have heart problems, you're going to have colon issues, digestion issues. Estrogen in a man is not a good thing. It was made for women, it was not made for men. And so therefore, if fat is estrogen, the fatter you are, and that's why men develop beer belly, so to speak, the gut. It's just a decrease, and that's why I believe and I've been preaching this for the last 15 years, sometimes get yelled at for it or whatever. Any method that you need to lose weight, and that includes drugs, meaning medical drugs, means a private trainer, means dietitian, nutritionist, anything that speaks to the person must be given to them.
Okay. I just think a lot of people today, when it comes to that, are looking for the easy way out. I don't think people want to put the effort
But you know what?
and want to do it the right way.
You're right. I mean, I think it needs
Well,
to be
one second. I'm going to eat a donut and it's 400 calories, and then I'm going to walk 7 miles with my wife, and I'm going to come back with my knees buckling, and I'm going to burn 400 or 500 calories. I mean, like, it just doesn't make sense. People are just looking for the easy way out. I want to lose weight. I'll take a shot. That's not the right way to do it.
But you know what? You know, there's a concept in our religion of Mashba Lolishma, Balishma. If at the beginning it might not be the smart way, it might be the easy way, but once they see the gains, they see the success, they'll change to another thing. They'll take it more seriously. Then they're going to want to work out. Then they're going to want to not take medicine. They're going to want to do that. So I think it's just it's a very deep topic, and I'm sure that I'm going to have people. I believe that any method they can do, that's what should be done.
Okay, so this is the last question. Oh, you want to add something else?
Yeah, just
I'm gonna
just
go
going back to diet. You know, so I usually tell patients, if you're having meat 3 times a week, have it once a week. If you're having a barbecue,
Moderation.
yeah, have a chicken burger, have a regular burger. So it's like you said, it's really, you can't tell them to become vegan.
Yeah.
So small steps
Right.
make long-term impacts on lifestyle.
And I think, we're live. Okay, I think you brought this point up before. And
Is
I
that
think it's
running,
very-
sir?
Are we
Oh, wow.
And I think it's very important. So here's the question. What is your advice to wives, daughters, and mothers listening out there?
So from GI, from colonoscopy, I'm gonna talk about it. I advise them, if they will, the best way the couple to come together for the appointment, to have colonoscopy. And we made it as a joke, the couples that they prep together, they stay together. And believe it or not, we have time of the year, but we have it for Syria. Now, I'm not gonna say the time, it's like around between Christmas and New Year, because it's slow by us. So a lot of Syrian will come, and I have a lot of couples, they coming
Wow.
only for colonoscopy.
Smart.
They do
Genius.
it-
Genius.
Because
I-
nobody wants to
You're a
do-
genius.
I do it as well with my wife at the same time, or we pick a day that we know we're not going to forget, a birthday or something, that this way we know, that's the day we have to schedule the
And
appointment.
help, it's very important the woman prepare all the preparation, get all the appointment, make sure that someone's picking her up. Also that's like for the diet, it's very important to have at home to prepare the food, and I believe they can do big.
As corny as it sounds, I think that the real doctor is the wife, or the daughter, or the oldest daughter. The real doctor is them. They catch the problems. They tell them exactly like you said. They cook. They're the ones who are limiting what they're putting in front of them. And I will tell you that, as I told you before, most of, at least my problems are brought out by the wife. And when they come alone, I say, I'm doing all the tests. Bring your wife back on the next time. Especially when it comes to prostate cancer, for example, they're not listening to a word you're saying to them.
So you're saying the women have the power?
They have the brains.
Okay. Good answer.
How, I'm not sure.
Yeah.
The brains they have.
I think it should be a teamwork. So there's no somebody who's superior on the other. It should be teamwork. As a human being living in the same family, they should work together. Which is remind the husband to go for their checkup, watch what they're eating. Also, the husband has to remind the wife to go for her checkup. Try to be on top of the screening on time. Encourage each other to go for a screening. And I think just be a teamwork. Nobody will be more superior than the other.
Yeah, basically, like you said, I think everybody plays a role, and everybody has to look out for each other's benefit.
Correct.
Okay, wonderful. Thank you. Thank you for your time. Thank you for your advice, expertise. The community owes you a debt of gratitude. We appreciate it. Thank you. Have a good night.
Thank you.
Thank you.
Thank you.